Hello, hello, hello. This is Jenna Cantor, performer and physical therapist, and I'm the founder of Powerful Performer, coming to you live to talk to an expert, an amazing expert on dry needling. And oh, you were watching me before. Oh, see, yeah, that's the nature of Facebook Live. Sometimes, so I'm doing, oh, I see you now. I see you now. Oh, this is going to be great. Bringing you on. Look at this, clicking. Sometimes it doesn't let you know. It's just, I think I say that in most of my interviews and talks on Facebook Live because it's just so unpredictable on if it's going to work this time or the second time. Who knows? But yes, talking about dry needling, I got to watch in the clinic. A lot of patients really loved it. Loved it. Love dry needling. And some, of course, were fearful of it because it's needling. But
There we
yes!
are.
All right. This gentleman. So please introduce yourself. You are a bit of a star on this topic.
Well, I don't know about the stardom, but I'm Jan Dommerholt, and I know a little bit about dry needling.
Yes, you know a little bit, right? So I heard about you because somebody else was talking about dry needling, and you're the name that like popped up, almost like the Godfather of dry needling. What is your response to that term?
Well, Godfather has memories of mafia and all that, so I don't think I belong to the dry needling mafia, to be honest. Um, but I was one of the first people who did dry needling in the States, and I was the first person to actually teach courses in dry needling in the US and in many other countries for that matter. So, yeah.
I honestly, I need your autograph. All right, but let's move into the good stuff. So why do some people, let's go into the kind of negatives to get to the positive. Why are some people not for dry needling? What are the
Well,
arguments against it?
it'd probably be better off asking those people that question, but I can give you some ideas.
Right.
I think that there is a bit of emotion in some parts of physical therapy to claim that the issues are not in the tissues, pain is in the brain, and therefore you should not think that there's such a thing as muscle pain or fascial pain or joint pain because pain is in the brain. Several of these people have been pretty verbal online telling me that I'm wrong, that I don't know what I'm doing, that I'm just doing this for financial gain because I teach courses and have other people teach courses. But I think there's an underlying misunderstanding that I think I'm not really sure I understand it, to be honest, because I think that when Mosley said the issues are not in the tissues, he meant to say, I'm pretty sure that's what it was all about, is that you cannot use tissue injury, the size of a rotator cuff tear, for example, as a measurement of how much pain someone's going to have. Because some people have a huge tear and have no pain. Other people have almost no tear and that hurt like nothing else. And so I think there's a difference there. I think that it is correct that pain or size of damage to the body has no impact on how much pain one will have. But that does not mean that there's no such a thing. And in fact, the same Lorimer Mosley has published himself in a sports medicine book that most common in chronic pain are trigger points, and the best way to get rid of them is with pressure and dry needling. So Mosley himself has published that idea that you shouldn't look at muscles because, oh, my phone's ringing, that you shouldn't look at muscles because the issues are not in the tissues and pain is in the brain, is really a flawed interpretation of what he really tried to say. I mean, Butler and Mosley never really said that you shouldn't look at the tissues. They never said there's no peripheral nociceptive input, but some people interpret it that way. Along with that, there are also people who say, like, why would you use an invasive procedure if you could do things non-invasively? And that's a fair argument, I think. That the reason why I still think that dry needling makes sense is because dry needling usually is so much faster in getting people out of pain. I have treated, actually this week, I had the fourth visit with a young lady, she's 23, I think. Chronic headaches, chronic migraine headaches for years. Her father is my accountant, so he said, maybe you can help her. And so in 4 visits, she's basically headache free with dry needling. And that's all I've done with her. A little bit of education, but most of it was dry needling. And studies have shown that trigger points in neck muscles 100% replicate the pain that people experience with migraines. So not saying that those trigger points are the cause of the migraine, but they're definitely an epiphenomenon. So why would you not reduce nociceptive input from the periphery that clearly mimics the headache pain, or maybe it's actually the exact same. So yeah, I don't think the argument that it's invasive and therefore you shouldn't do it holds water. Healing after dry needling is very fast. If people are sore for anywhere an hour to 2 hours to a day and a half maybe, then they're fine. Healing occurs very quickly within 3 days to 4 or 5 days. The tissue injury that you caused with a little needle has totally healed. There's no scar tissue. There's no other repercussions if everything is done right. So I still think that dry needling makes sense in spite of the opposition of some people. Last argument, there's still a lack of good research. And that's a very valid argument as well. There are a lot of studies that show that dry needling does not work. There are also a lot of studies that show that dry needling does work. More recently, the number of papers that show that dry needling does perfectly fine has increased dramatically. There's actually a study on that showing what is the quality of myofascial pain research, and every decade it gets more page points. So every decade it gets better. A lot of the older studies are not very good. A lot of the current studies are not very good. I review all the myofascial pain literature for the Journal of Bodywork and Movement Therapies, and many times we conclude this is a very poorly done study. And as a result, the conclusion that dry needling does not work or does work is not warranted by the study. For example, it's a long answer for a short question, isn't it? But
no, this
for
is
example,
great. This is great. People are putting hearts. People are loving this right now. So keep going.
All right. Okay. So as an example, a lot of studies, and I understand that I've done plenty of studies myself, and I'm involved in quite a few studies all over the world. It's very difficult to do dry needling studies. You can't really do a sham procedure. You stick a needle in someone or you don't. People know that they got needled or not. There are sham needles. They don't really work that well. People still have a sense whether they got needled. If you ask people, did you get the real thing or not?
Yeah.
Most of the time patients know whether they got the real thing or not. So it's very hard to blind. Secondly, you need a protocol in studies. So the study format that many people use is one needle stick in one muscle, maybe get one local twitch response, and then they assess within 24 hours whether it made a difference. Well, everything is wrong about that study, because then they conclude that either dry needling works great, or they say, oh, dry needling doesn't work. What they should conclude is sticking someone once with a needle in one muscle with one twitch response does not work, or maybe in some cases it does work. But that's not the practice of dry needling, just sticking someone once with a needle. So it's not the same thing. Also, measuring pain right after needling has been shown to be the wrong thing to do. Because if you do it right away, people are sore from the needling procedure. So studies have shown you need to wait at least 48 hours if you want a local pain assessment before you actually says, did this work or did this not work? Mm-hmm. Most of my patients, when they leave my office, they're pretty sore. Some more than others. Some people really don't care about soreness. It's an irrelevant issue for them. But other people are quite sore, and it's like, oh my God, you really got me today. They come back 2-3 days later and said, oh my God, I didn't have a single headache. I feel so much better. It's great. Then when I palpate the same muscles at that point, 9 out of 10 times they feel much better. And they always say, but you're not pressing as hard.
Yeah. Somebody actually asked while you were talking, but I wanted to wait because this was so helpful. Yep. What is the difference, when somebody asks, what's the difference between dry needling and acupuncture? What do you say?
Yeah, I knew you would ask that question. I testify on that question quite a lot. I just spent a week in Florida.
I'm sure you do.
Yeah, well, it's a very contested question and a very tricky question. You're in New York, and in New York is definitely a tricky question because New York does not allow dry needling by physical therapists at this point. California does not, and several other states. 35 states plus the District of Columbia allow dry needling by PTs. Some states allow dry needling by OTs, and some states allow it by athletic trainers. All states allow dry needling by acupuncturists. And from an acupuncture perspective, dry needling, and you'll see that in many, many publications online and in the literature, you'll see that they believe that, and they feel strongly, that dry needling is just a way around not getting an acupuncture license, not getting a diploma in acupuncture, doing acupuncture without a license in acupuncture. And the techniques of dry needling, to some extent, have been described in the ancient acupuncture literature, in lifting and thrusting technique, as they're called. But at the same time, I allow acupuncturists to take our dry needling courses. I'm one of the few dry needling course providers that allows that to do, to acupuncture to join. Without exception, every single acupuncturist who've taken our courses says this is completely different than anything I've ever done in acupuncture.
Okay.
So on paper, it may look similar. Yes, we use a similar type needles. The needles we use were specially made for dry needling. They're a little bit different in quality and characteristics than a typical acupuncture needle, but you can use our needles for acupuncture and I can use acupuncture needles for dry needling. The needles we use are specially made for dry needling, and the FDA has actually allowed us to market those as dry needling needles. They're classified still as acupuncture needles. So from an acupuncture perspective, and you hear that a lot, dry needling is nothing but a form of acupuncture that's stolen by physical therapists, and I'm one of the guilty thieves there apparently. I've stolen it from acupuncture with the idea that now I can practice a small part of acupuncture without ever having to study acupuncture. The flip side of that, my perspective, and that's how I got to dry needling, has nothing to do with acupuncture. I learned it directly from Dr. Jan Dommerholt, from Dr. David Simons, the people who wrote the Trigger Point Manual, which is about to come out with a new edition, by the way. It's about to hit the shelves, I think. I also learned from Bob Gerwin, who was a prodigy from Janet Travell, and he and I worked together for many years. I worked for David Simons for over 10 years. At the end of his life, we spent a lot of time together. We actually wrote articles together. We did this review article together. And Travell and Simons did nothing with acupuncture. Dry needling, the way I was learned to do this, came strictly 100% out of trigger point injections from a very medical, Western medical perspective. Travell knew very little about acupuncture. She was, I was just in Florida and I was giving letters from Travell from the 50s and 60s when I was on the stand in the courtroom. And these letters, they got them from her library, the Kennedy Library, because she was the physician of John F. Kennedy. So the John F. Kennedy Library apparently has letters from Travell, which I had actually never seen before, in which she talks with someone about, oh, acupuncture, isn't that interesting? We have to look into that sometime. But that was already way after Travell developed her dry needling, her injection techniques and the whole concept of myofascial pain. Travell really didn't get introduced to acupuncture until the mid-80s, actually when a New York-based acupuncturist, very, very well-known acupuncturist, Mark Seam, Dr. Mark Seam, who founded the Tri-State College of Acupuncture in New York, when he contacted Travell, as he writes in his book, A New American Acupuncture, he contacted Travell and said, this is the missing link after he read her book, the first Travell and Simons manual trigger point book, a trigger point manual. When he saw that book, he contacted Travell and said, this is the missing link in my acupuncture practice. So it was actually the exact opposite direction of what most acupuncturists today claim. Most acupuncturists say, and you can look on Facebook, you can look on websites, that Travell lifted this from acupuncture. Most people say, those websites say that I stole it all from acupuncture. It's actually, it has nothing to do with what really happened. I have been forced to look at the acupuncture literature because of all the accusations that were thrown my way, but none of them holds up. And the other notion is that in the acupuncture world, there's a strong idea that that needle is reserved just for acupuncturists and for physicians who study 200-300 hours of acupuncture. So in many states, in my own states was the case, but also in other states, acupuncturists say, well, if you want to do dry needling, if in other words, if you want to do acupuncture, you need to do at least the same as physicians do to practice acupuncture, which is 200-300 hours of postgraduate studies. That's easier said than done, but it also doesn't make sense. First of all, there are no courses for physical therapists to do acupuncture in that way. The only way physical therapists can be a full-fledged acupuncturist is by going to a school of acupuncture, spend $80,000, $90,000 on becoming an acupuncturist in addition to your PT degree. Right. But what they say now is, so if I would study 200 or 300 hours of acupuncture, they also say, no, you can't do the whole scope of acupuncture. You can just do dry needling. So that makes no sense at all. So if I study acupuncture like a physician would, I still could not practice acupuncture like a physician could after those 200-300 hours, because it would still be restricted to dry needling only. Dry needling is really not that hard. If you're a physical therapist, 86% of the competencies you need to know, you already know from your PT degree.
Yeah.
I mean, the Humber study that was done a few years ago commissioned by the Federation of State Boards of Physical Therapy made very clear, it was an independent study, 86% of what you need to know to do dry needling safely, you already learned in PT school. So it's only 14% of competencies you need to learn. So what did some acupuncturists do then after that? I mean, I have to testify against that. And this did not come up in Florida a few weeks ago, but it did come up in Washington State, I believe, that 14% of an education in acupuncture would be so many hundreds of hours, as if you can translate a competency in number of hours of study, which it makes no sense. It's a very irrational argument. And on top of that, the Pew Health Commission has clearly supported and stated in many studies that an overlap in scope of practice is essential for a functional healthcare system. We all have overlap. When I use a stethoscope to take someone's heart blood pressure, I am not holding myself out to be a cardiologist, although the tool I use is exactly the same. I'm still a physical therapist who checks someone's heart rate or blood pressure or whatever I need to check. So when there's a overlap in scope, we had those same arguments a long time ago with chiropractors. Now, chiropractors said physical therapists can't do adjustments because that's chiropractic. And the physical therapist would say, no, we are physical therapists. We're using a very different philosophy, different theory, different clinical reasoning process to come to the decision to do manipulation. So in a chiropractic sense, the manipulation was nothing but an adjustment, what they call adjustments. Vice versa, that argument was never made. Physical therapists never said, oh, but you're practicing physical therapy without a license because you're doing manipulations. You know, so physical therapists get attacked by these fields, and then chiropractic that's much less now. But acupuncture is still pretty busy. I mean, although with 35 states and the District of Columbia, this is a development that cannot really be stopped anymore. They're still hopeful. They're still trying. In my own state, Maryland, I live and work in Maryland, and it's been very common that in 2009, the acupuncture board protested dry needling. It was approved in Maryland in 1984. So 25 years of dry needling without any complaints to any state board in the state, all of a sudden was a danger to patients. It was a public health hazard. Yeah. There was no evidence whatsoever of that. And that's the argument they use. So the acupuncture opposition is always very quick to bring up the few cases that are in the media, typically in the media, and some in the scientific literature, where physical therapists caused an adverse event. Yeah, clearly those things happen. I'm not arguing that at all. They do happen. At the same token, these things happen in acupuncture practice too.
I was about to say, yeah, right.
Acupuncture is caused pneumothorax. Yeah. That happens in every field. Whenever you use an invasive procedure, there's an inherent risk. The risk is super small in the competent hands of a competent individual. I mean, we did a study in Ireland of 7,629 treatments, I believe. The number may be off, but I'm pretty sure that's it. Prospective study on the risk of adverse events. The risk of a significant adverse event was less than 0.04%. And then we're talking about a pneumothorax or perhaps an epidural needling procedure, which is actually, in my opinion, much more serious than a pneumothorax. So that can cause issues, that cause trouble. In Florida, the attorney who questioned me for 4.5 hours nonstop pulled that study. And actually, it was funny because the study is Brady et al., and I'm one of the et al., but I didn't realize that. So they said, well, a study by physical therapists. Are you familiar with that study? He said, well, I'm one of the authors. So yes, I'm fairly familiar with this study, which was kind of funny. Then she said, how did you get this paper? He said, your acupuncture specialist brought this to the table. He never read the paper either. He just saw Brady et al., and he focused on one number. Because in that paper, we state that the adverse event rate was 19.3%. So meaning 1 in 5 patients with dry needling had an adverse event. Now that sounds horrifying. And 1 in 5, that's a high number. But if you look at how the paper how it was defined, the study was done in Ireland. I teach courses in Ireland. So the main author was a physical therapist who went back to school, got another graduate degree, and this was her dissertation project. So I was on her committee. and on her paper in the end. We use the European definition of adverse events, which means every outcome that's not the intended therapeutic outcome. So in other words, if I stick you with a needle or I put a piece of plastic on your skin and you say, ow, that's an adverse event. Because that's not my intention.
It's setting
to
us
hurt
up
you.
for failure. Yeah.
Yes, it's not. So if you have you're sore after the needling, that's an adverse event, because my goal is not to make you sore after the treatment. My goal is to make you get rid of your headache. So if my goal is to get rid of your headache and you have soreness afterwards, that by definition is an adverse event in the definition we used. So it was contrasted with an acupuncture study from Germany, where the adverse event rate was only 8% or something. And it says, see, right, PTs are very dangerous. The reviewers of the paper, this was published in the Journal of Manual Manipulative Therapy, actually got back to us with comments. Why do you call it even an adverse event? Isn't that normal that when you stick a needle in somebody, it's going to be a little sensitive? I said, yes, of course it is, but we use the European definition of adverse events like was mandated in the school in Ireland as part of the EU. She had to use that definition. And it's a perfectly fine definition. You just can't take it out of context. The first most common adverse events was pain during and after needling, pain during and after. Those were the first two. The second one was bleeding, and the third was bleeding. The fourth one was hematomas. You could argue that 1 and 2 are the same, and that 3 and 4 pretty much are the same. You bleed, you're probably going to get a hematoma. If you take those away, there was 2.8% left. So 17.5% of that 19.3% number was pain during and after needling, a little bit of bleeding, and hematoma. So those are almost irrelevant adverse events. The critical number of that paper was the 0.04%. That is the adverse event for the risk of significant adverse events like a pneumothorax or a subdural hematoma. And those are things that count. In my opinion, my patients extremely rarely will say, oh, you can't do dry needling because it hurts too much. Now, clearly, people come with a certain expectation to my office. That's clear. I mean, an expectation does help outcome. Actually, the reason is today I had a discussion with my colleague in Ireland about expectations. And we talked about why this is such a discrepancy between some studies and what we see in our clinic. And clearly, when people come to us, they expect that we can help them with their headache because some friends told them, I only had 4 treatments of migraine treatment, my headache is gone. Yeah, so clearly there's a high level of expectation. In the study, there is really no expectation because people really don't. They have no expectation because they just participate in the study, want to pick up the $25 at the end of the hour. Yeah, so there's a very different thing. So there's no question that anticipation or expectation of an outcome in therapy occurs with all kinds of physical therapy, with all therapies. You don't go to a chiropractor if you don't expect that the manipulative adjustment will help you. So you don't go to a doctor if you say, well, he's probably not going to be able to do anything for my low back. You wouldn't commit to surgery, bypass surgery, if you didn't think it would save your life. So there's always an expectation of a positive outcome, and that's no different in physical therapy. Even the TENS units, which you would think is pretty objective, it's a current, it does something. Expectation made all the difference whether TENS works. I mean, there's studies on that. I saw this today for the first time. And like, wow, that's pretty powerful. So, yeah, the acupuncture arguments are interesting. They don't make a lot of sense from my perspective. They make a lot of perspective of sense from the acupuncture perspective. I honestly believe that other disciplines should not try to interfere with another discipline. I think that acupuncturists should not try to, or should not worry about the scope of PT practice. At the same time, having said that, I also believe that physical therapists should not do the same thing. I mean, physical therapists are just as guilty as acupuncturists are. Acupuncturists, oh, it's acupuncture, you can't do that. Physical therapists said, oh, athletic trainers, you can't do that. That's physical therapy. Or massage therapists, oh, no, that's physical therapy. You can't do that. So the physical therapy field is just as guilty in interfering with other disciplines. I honestly believe that each discipline is responsible for defining their own scope of practice. And in physical therapy, the APTA has endorsed this, 35 states have endorsed this, plus the District of Columbia. AOMT has endorsed it, the American Academy of Orthopedic Manual Physical Therapist. Back in 2009, they were the first to endorse this. as far as professional organizations. So the acupuncture arguments don't hold a lot of water. In Florida, they took it a step further. I don't know if you're familiar with the Florida Statutes of Physical Therapy. They actually said that physical therapists can do acupuncture as long as they don't puncture the skin. Yeah, so that's saying we can do acupuncture in Florida as long as we don't penetrate the skin. Yeah, that seems impossible. But it depends on how you define acupuncture. In Florida, in the law, acupuncture is defined as the practice of Oriental medicine that may include puncturing the skin, Oriental massage, herbal remedies, and a bunch of others. Qigong, I think, is even in that definition. So even there, it makes no sense, because now it says that physical therapists can do herbal medicine. Because we can do acupuncture except puncturing the skin, which means that we can do all the other things that acupuncture is allowed to do in Florida. And clearly, it doesn't make sense. These statutes were developed in 1978, before there was even a physical therapy board, and they've never been adjusted. So they were developed by the medical board in 1978 in Florida, and they have very little correlation with today's practice of physical therapy. I was asked, for example, to explain how physical therapy is a property of air. And I have no idea what that means. A property of air, mechanics, and chemistry. And you're a lawyer. It's like, can you explain what this means to me? Because then I don't know what that means. So in other words, those statutes were so outdated that now it's up to an administrative judge to see what they're going to do with that. Because clearly it doesn't work. They tried to make me believe that acupuncture in Florida is surgery. That acupuncture in Florida are allowed to do surgery. Yeah, and the acupuncturists who testified tried really hard to speak physical therapy lingo, but he mentioned the palmar aspect of the foot. Well, we know we don't have a palmar aspect of a foot. Many terms that he used, anatomical terms, he used incorrectly. But he can do surgery. And why can he do surgery? Because in the Florida statutes, it says that surgery uses needles. So their argument really says surgery uses needles. We use needles, so we do surgery. And that makes no sense at all. So a physician who testified in Florida said, no, we don't use needles for surgery. We use needles for the suture. But that has nothing to do with dry needling. So the attorney for the acupuncture club, the Florida State of Oriental Medicine Practice, the Oriental Medicine, I think it was called, or something like that. He gave me the definition of surgery by the AMA. And you may know the AMA has written an opinion against dry needling by physical therapists a few years ago. So the AMA, he said, do you know the AMA? He said, yes, that's a medical society that represents less than 25% of doctors in America, which is true, by the way. But 18% of physicians in America are members of the AMA. People seem to think everyone is a member of the AMA, but that's only 18%. Add some medical residents and students to that, you come up to about 25%. So the small percentage of physicians was against dry needling. So he gave me the definition of an organization. They had adopted the definition of surgery. So I was asked to read the definition of surgery because acupuncturists can do surgery in Florida. You know that. Well, I find it hard to believe, but if you say so. The definition said that surgery, the purpose of surgery was to alter tissues, human tissues, through surgery, and then by means of, and that included laser, ultrasound, and needles as well, among some others. So therefore, the attorney said, see, there's needles. So the use of needles in Florida is considered surgery. He said, I find that hard to believe. That is a logical fallacy. Said, are you really sure? I said, if I follow that logic, that means that if you're pregnant, Jana, I don't think you're pregnant, but if you were pregnant and you have a follow-up with your doctor and they do an ultrasound on your stomach to see the health of the baby, ultrasound is in the definition of surgery in that college in Florida. That would mean that your doctor is doing surgery by looking at your baby with an ultrasound. Or when we use ultrasound sonography to look at muscles and tendons, we would be doing surgery. Yeah, of course, there is an ultrasound, the sonography option for surgery. There's laser was mentioned in the definition. He said, so what you're saying, if I follow your logic, that every time I do a PowerPoint presentation and point at the screen with my laser pointer, I would be doing surgery? Surgery, in fact, cataract surgery, yes, I'd like them to use a class 4 laser to fix my cataract. But a class 3A or 3B laser, which I used in physical therapy, or a class 2 laser, which is used when I do a PowerPoint presentation, has nothing to do with the definition of surgery, nor does the use of needles have anything to do with acupuncture dry needling. So some of these arguments are so far-fetched, they make no, but by now I've heard most of them. I've testified in over 15 states, and always about the same arguments. The surgery was new to me. That was a new argument. But again, when you look at the value of the argument, it makes no sense. It would make so much more sense for acupuncture to accept that there is scope of practice overlap, that physical is not a threat to acupuncturists, actually quite to the contrary. When in Maryland approved dry needling in 1984, the Maryland board did, there was not even an acupuncture board.
Yeah.
The Acupuncture Society of Maryland agreed with that. They said, yeah, that's fine, PTs can do that, that's not a big deal. Now that it gets much bigger, there are many, many physical therapists now who do dry needling. The 35 proved it, and my estimate, conservative estimate, there's probably between 20 and 40,000 PTs in the country who do dry needling. Now, I don't know that for sure. There are 7 different education companies that offer dry needling now. For the first 10 years, we were the only one, but we have a lot of competitors now. A lot of my former students are now teaching courses, which is totally fine with me. That's okay. It's a big country, big world. It's not a problem, as long as they do the right quality. But so I don't really know how many PTs there are, but it's probably at least 10% of the workforce of physical therapy use dry needling. Yeah, in Maryland now has a school for acupuncture. The fact that we do dry needling in anything, I don't know that for sure either, but I would anticipate that it actually helps the profession of acupuncture by legitimizing the use of that needle in healthcare. Now, they get upset because we have third-party reimbursement, and acupuncture many times does not. So in the end, it's probably more about economics than about the facts of the case. So that's a very long answer for a short question, but the arguments
It's
that
very
acupuncture
helpful,
make to me
though.
make very, very little sense.
It's very helpful because you're giving such a good insight of like all these viewpoints and how everything's a lot of professions almost just kind of work against each other and just really the basic patient better. And there's not some sort of, way that we're all acupuncturists are putting forward their opinion in every state. It seems very different in every state. So people get certain rights in some and they don't in the others, which is unfortunate. And they can really benefit from it. Where I would love to end this interview, I just have one more question. And this is for people who do not have it in their states, because clearly we're seeing a great benefit from it. People who've taught and learned from you, Fitzherbert, physical therapist, wrote on here, oh, that's the gentleman who taught me. Everyone's so thrilled to see you on here and hear you speak. But I'm in New York, and if I just go over, the water to New Jersey, that just got taken away as well. So what suggestions do you have for those of us who want to try to get it back?
Additional hiccups. The best way to go is go to the APTA chapter and let the APTA chapter go to the APTA chapter in your state and say, look, this should be in a scope of practice. It's in states. That does not mean it's not in 15 other states. Many states have not decided. Like some states, it's illegal. Now, why you're not allowed to penetrate the skin? If you want to change it, they require a statute change. Just like in Georgia, the statutes changed, which is what needs to happen in New Jersey as well, where the Attorney General said your current Practice Act does not really include the right to do dry needling, so you would need to change the Practice Act and then you can look at it again. Georgia did the same thing. Some other states have done that. A few states have not really ruled. They sometimes because they're not allowed to rule. Like one state example is Pennsylvania. Yeah. In Pennsylvania, the State Board of Physical Therapy is not allowed to render an opinion on the interpretation of the law. Now that seems odd to me because what are they there for? So in Pennsylvania, you cannot get an answer, can I do dry needling or not? They can only say it's not. It doesn't say you can't. It doesn't say that you can. The risk of that is if you do dry needling and you would cause a significant adverse events and get a lawsuit, your malpractice insurance may say, hey, let's call the state board. Have you approved dry needling? And in Philadelphia, Pennsylvania, they're going to say, no, we can't. And then you may not have coverage for the injury you may have caused or the claim against you. But the vast majority of states, some states are neutral. They said, we don't really care. It's fine, whatever you want to do, but they have no official ruling. Some states, it's illegal. Like California, New York in 1991 ruled, 1992, 91 ruled that you couldn't do dry needling.
What about Florida? Somebody's asking about
very
Florida.
Short period.
How do you think they will rule?
Well, that's a good question. I have no idea. I spent a week in Florida. I first spent a day in depositions. I flew back and came back a few days later. I was in court for a few days with an administrative court law judge. I don't know. It all depends on who the judge believes more. I mean, I did my best to speak on behalf of the physical therapy profession. I was there on behalf of the Florida Physical Therapy Association. Our colleague Ido Zelstra, from the head of Kineticor, and the other major dry needling company, I think, he was there as well. We spent a lot of time together and had always a good time together, to be honest. And he testified on behalf of the Florida Board of Physical Therapy. So we probably know a lot about dry needling, and we try to really say, like, look, kind of what I suggested you today. A lot of these arguments just don't make any sense. It's up to the judge.
Yeah.
The judge has given the lawyers till October 1st to file their briefs. Then officially the judge has 30 days to make a ruling, but 9 out of 10 times judges ask for an extension. And so it may be sometime end of the year, maybe sometime early next year. But I honestly don't know.
Yeah.
Does this judge stick out his neck and say, like, hey, yes, that makes no sense. It was written in 78, function without penetrating the skin. That's what I hope he says. Hopefully he say, like, no, dry needling is clearly something different. There's a lot of rulings by attorney generals in many states that have said that. Now, New Jersey was not one of them. New Jersey, the attorney general said, this is not, you can't do this. Like in Oregon, attorney general said the same thing. I'm cautiously optimistic in Florida because there are already 2 physical therapists in Florida who can do dry needling. I mean, Rob Stanborough is one of our instructors. He got a declaratory statement that he can practice dry needling in the state of Florida, issued by the Florida State Board. Another physical therapist, Mr. Reese, he was also there. He got permission from the health department in Florida to do dry needling. So there are already 2 physical therapists who, within the civilian world, are allowed to do dry needling in Florida. And besides, dry needling is totally approved in the armed forces. So everyone on the military base in Florida, in the VA, can get dry needling. So it's not that dry needling isn't practiced in Florida. It's just they need to get over this hump. It's like, well, what's going to happen? It's hard for me to believe that the judge would not approve it, but no one really knows till he makes a decision. So I can only speculate. I'm hopeful, but I can't tell you anything for sure. I don't have a crystal ball. Right.
Thank you.
Any other questions?
This was honestly, you have no idea. When you look at this later, I have to go. But my feed hasn't been this on fire before. People are so excited. Dry needling is a popular topic, and I'm so happy to have you on here because a lot of people want to hear you speak and get your insight on the history, and everything you were saying is completely valuable. So thank you so much for coming on tonight. I appreciate it.
My pleasure. Thank you for the opportunity to do this. Appreciate it.
Oh my, amazing. All right, well, take care. Thank you.
Okay.